And so when I think about why am I thinking about it that way? Why is my mindset the way it is? Why did I, have that courage? What is that? And it's because I'm going to share something that may not be very popular with leaders in my space. The devastation it had on my family, and so because we were not equipped to deal with this. My mom, my parents, the adults in my life were not equipped to deal with this.
Hi, everybody. I'm Brenda Myers, and I'm so happy to welcome you. This episode, we get to be with Brenda Rodriguez and talking about healthcare and community health at that. And let me tell you a little bit about Brenda before you hear her amazing story and all of the incredible things that she is doing in her present position. So, Brenda is an accomplished healthcare executive with a diverse and a progressive career. And I love saying that. And you'll know more about why it's defined and described that way. She is the CEO presently of Lynn Community Health Center in Boston. Well, near Boston, it's in Lynn. She has served over 10 years in community health centers, most recently in Lowell as their chief strategy and financial officer, successfully growing strategies and equitable healthcare practices. She drives success through collaborative leadership, and we'll hear more about that, and inclusion. Prior to her work in community health, Brenda led financial and operating practices in education and media firms and began her professional career at PricewaterhouseCoopers. As a lifelong FQHC, if you don't know what that is, at the federally qualified health center patient, Brenda brings a passion for comprehensive patient-centered care to Lynn Community. Brenda holds a Master's of Business Administration from Duke and a Bachelor of Science in Business Administration from Boston University. Welcome, Brenda, to Sundays with Verna.
It is a pleasure and honor to be here.
Oh my goodness, I have so many things to ask you, but first and
Yes.
foremost, you're the CEO now
Yes.
of Community Health Center, and I just want to hear more about what Community Health Center is about and what your role is there, like including like what's your day to day like.
Wow. So thank you for that introduction. And Lynn Community Health Center, it is such a special place. It's one of 1,500 federally qualified health centers and lookalikes in the country. And together we serve over 32 million people across the country. Lynn Community Health Center serves 42,000 patients in and throughout Lynn, Massachusetts, in the North Shore area of Massachusetts. And what's so special about our organization and our health center is that our mission is to serve patients regardless of their ability to pay. But it is regardless of whatever barrier they encounter. They come to us in many languages with many chronic conditions. It doesn't matter if they're unhoused. It doesn't matter what insurance they have. It doesn't matter their socioeconomic status. We're here to serve them. And so it's such an honor to be in this role. And my day to day, more and more, is about advocacy. And I am the chief advocate for my organization. I am the chief diversity officer. I am the chief champion for patient self agency and in our community health. So that's a little bit about Lynn Community Health Center and my role.
I can hear the advocacy coming through
Oh
loud
yeah,
and clear.
oh yeah.
And I love this idea of patient agency. I hadn't heard it said like that before, but of course, this is something that no matter where you are in the medical system, one has to be an advocate and one has to have to like take agency because sadly it really isn't the common experience for so many people. And so I'm glad that you're there. Tell me what the experience has been like for you to take on this role, including like what has been exciting and satisfying, as well as maybe things that
Mhm.
might be a little difficult and surprising.
It is more than an honor to be stepping in this space as a Boricua, as someone representing my community and representing the lived experiences of our patients. And so what has been exciting and new coming into this role as a new CEO, unknown really to people in the organization, unknown to many in the community. My aim has been to to lift the agency of our, not just of our patients, as I mentioned, but to give our staff some transparency about what to expect from a CEO. So I started right away sharing my vision, sharing my priorities, and my expectations and standards. And so those have been around investing in areas that have been neglected for far too long. That is really bringing inclusion to the organization in a way that's different, in a way that's fresh, in a way that makes everyone feel like they know that they matter and they know how they're making a difference. And it's also about amplifying our work, sharing with anyone and everyone that will listen the power and the resiliency and strength of our workforce, of our organization, of our patients. And that is so important. And then really developing a vision for the next few years and really thinking about what is our moonshot? What is our moonshot for our organization? What is our moonshot for community health centers across this country? And how do we, in our little world here in Lynn, Massachusetts, how do we drive and advance what needs to be done to really eradicate healthcare disparities? And I'm blessed and fortunate to be, part of that conversation and leading this amazing organization in that effort.
Yeah. Wow. I love so many things about what you said, the idea of vision, the idea of people realizing that they're valued and included and bring a great deal of capabilities, understandings, perspectives that obviously sometimes are overlooked and undervalued, but also this idea of excellence and
Yes. Yeah.
and transparency. I just rolled out of a position head of DEI for Netflix, and I remember being so excited about being inside a company where a CEO was clear about a vision and clear about culture and requiring excellence and everybody sort of getting kind of, I guess, compelled by a
Yes.
vision and by a set of standards and by feeling like you could make a contribution and it would be appreciated. So I'm so grateful that you're that kind of leader. How's it going? And then what has it been like? What have been the surprises? Give me one of the surprises.
Oh my gosh. So, I, being a leader in this space, you not only have to pull yourself up from your bootstraps, you have to, pull up your bra straps a few times a day. You need to put on a back brace, and whatever you have to do, you have to make sure that your posture is firm and that you're standing tall. So, what I have been finding, surprising is that I thought that we were further along than I thought. I have not expected, even in my journey to around cultural proficiency and competence and all of that. Even coming into this space and the amazing diversity that we have in our community, having to take a step back and really understand who our community members are. And so, because being Guatemalan, being Puerto Rican, we're not one and the same.
Right.
Just like being Italian, being Irish, we're not one and the same. And
Yes.
so, but understanding those nuances and then being a champion of that with our analytics team, with our board, with our executive team, and making sure that we are not just saying we have an equity perspective, but how are we analyzing those disparities and how is that informing our programming? How is that informing our hiring practices, our promotion practices? How is that informing our quality and healthcare programs? That work to make this equity and equitable health practices real and true is something that I tell you it's going to be a lifelong work that I do, but I'm so committed to it. But I'm surprised of just how much work we have to do in both educating, members across, stakeholders across the organization, from the board to our staff, and then as we get about doing that important work. So, but
Yeah.
I'm up for it. I feel invigorated, and we have so many people that are really in it, and we all want to learn how to do it and how to do it together. And so that is the work that I have, the duty that I have in helping us, sort of shepherd this experience together.
I know that you've had quite a varied career path, and I wondered if you would share that with our listeners. So, how did you get to this role
Ugh.
and to generally to being in this community health uh, arena? So, start us off from your first job and take us to this first, the one we are in now. Okay, maybe not your first job, but what
So,
what was your first job?
my very first job was pulling weeds from a garden at $2 an hour. But then my first real paid job that required an I-9, required, some tax work was at a fast food, at Burger King, and I did that. And then worked at a health center, my first paraprofessional job as an executive assistant. And I think that gave me a love early on for health centers. And then, went on to get trained and educated and went into professional services, and eventually I found myself back at a community health centers. So my path has been very interesting. This work, and I think you share this as well, is what we do professionally is really an intersection between our values and purpose and meaning, and the education, training, and work opportunities that we get. And I am very fortunate that finally those things just intersected. And so I was ready professionally for this role. But in terms of, it takes more than just your professional readiness. It's really about identifying with your meaning and purpose. And that started so many years ago. It came about through some failures in different work experiences. My not, the work not feeling really connected, to that work. It came from amazing work experiences I had where I got to go to places, whether it was in a different department or around the world, to really get a sense of how people were living and experiencing things. And then it also came from just seeing what was happening in my community. And so I grew up during the AIDS epidemic, during the crack epidemic, during the the difficult times of gun violence. And that was my normal experience. And so it was a community health center that was the place that had stability. It was a place that people like myself, through a tragic incident, I was pregnant at 11 years old. And it was a community health center that really helped me with that emotional and physical trauma. And it was the community health center that connected my family and I to the summer camp, and to bilingual education. As I got older and was a young wife and had young kids, connecting me to to the WIC program, so we can have some additional provisions in the home. And it was the one place that I could go to that I remember to this day, that I never felt less than. I never felt judged because of just where I grew up, or because of our language or ethnicity or race. And I carry that gem with me. I carry that in terms of my standards and expectations, as far as us being a patient-centered home and being the place that doesn't matter if you're a refugee, it doesn't matter if you've been in a community as a long time resident, or you just arrived as with very little. We are going to be the place that's going to take care of the whole person. And I'm so proud that I'm finally in this space, professionally and personally, that I understand that is my highest purpose, and anyone working in community health.
What you're saying reminds me of when I was in Boston and was part of a leadership group. We had a chance to go to Dimmitt. Is Dimmitt still in operation? Dimmitt Community Health
Well,
Center.
it is.
And
It
I
is.
remember that same feeling of watching people take in, receive support, speak to, care for so many different types of people. And I just remembered thinking these people are doing God's work, right? These people are making life possible for so many of these people. And these people are also bringing the patients and our members are all bringing their extraordinary, strengths and resilience and
Yes.
capabilities and talents as well.
Mhm.
And so it's almost like, when they come in the front door, that's just the assumption that, there are these
Mhm.
worthwhile, worthy, human beings, which is my assumption is that that's not how some of these folks what they experience in a lot of the other parts of their life. And
Yep.
so just you mentioning that brought
Mhm.
that memory back.
Yes, yes. And Dimick is alive and well. Dr. Charles Anderson is the CEO there, and it is a gem and a legacy in the Roxbury community.
Oh my gosh, I know Charles. I can't believe that's his role. Oh, how fantastic. It makes so much sense. Makes so much sense. I want to say that
Mhm.
along this amazing environment in which people come, they're still part of a larger medical
Mhm.
uh, world where
Yes.
there is all sorts of isms and
Mhm.
biases, and as you already mentioned, disparities. How do you deal with that as a leader, and what are you seeing? Are things getting better? How are you approaching some of these really difficult structural and personal and interpersonal problems that we see within the medical world?
Well, I'll say that I do not see it getting better, and but it can and it will and it has to. So I'm going to share something that may not be very popular with leaders in my space, but some of the things that you have to do as a community health center public health leader is are those really tactical decisions that signal to the healthcare system that your patients and your community matters. And so early when I started, we had a fire incident that resulted in a loss of lab, loss of service. And unfortunately, a hospital partner could not, meet our needs. And I had to go with a different partner that could meet our needs because I wasn't going to have our patients travel 10, 15, 20 miles for lab work, which is, I think, at the time, the opinion has changed since then, but at the time, that was considered okay. And so I know the power and strength of our community and of our patients. I know what they deserve because I've been a patient and I am a patient. And so we should not expect anything less than what anyone else with any other insurance card would get. And so those little decisions, and they're not so little, but those decisions that I make as a leader of my organization in terms of what I am willing to accept for our community is something that every single day I have to grapple with. And I tell you, the pressure from larger systems for us to acquiesce and do things the way they've been done for many years is a real pressure that CEOs and community health centers have. And that's why being connected to this work, engaged in this work is so important. So I'll say that. The other piece is looking at addressing, these structural systems across the board, externally and internally. So externally, one of the ways that community health centers really are a significant disadvantage is that when you look at the dollar, $1 of care that is spent, we may get 6 cents out of that, 8 cents out of that. And so, really, rebalancing the distribution of dollars in order to invest in the community, invest in preventive health, invest in helping people focus on wellness and the things that really matter, and those really truly addressing the social determinants of health. That is the job as a health center leader that I have, is to convince the overall system that, first of all, it's financially the best thing you can do in terms of return on investment.
Right.
And
I don't understand why we don't understand
and
that,
and
but
it and it's but it's because of this hearkening to this power dynamics and this power system here and how to rebalance that power. Because most people that are in a community health center and doing this work, more and more of these individuals are people of color. And so we're the ones that are going to be advocating for this. And then internally as a leader, I'm looking at equitable pay practices. And I have I say often to my teams is no one asks for low standards and low pay. No one ever asks for them. So we have to raise the standards in our management practices. And so I look at, I'm looking at making the right investments, and we have to look at the right investments We absolutely always have to look at costs, but we need to look at those investments that down the road are going to improve the health of our community, the health of our patients, and long term are really what's going to, save our system, those dollars, and really invigorate the system, and put the care back into the patients, into their hands. And so there's a lot of work that we have to do as leaders, but a lot of it begins with making sure that we're clear on where is our duty of care. My duty of care, my duty of loyalty is with the community. And I'm very, very clear on that. And I think that that's the start.
When I listen to you, Brenda, I am warm inside. I feel like, thank goodness there are people like you who are sitting in these positions. And I think about the courage it takes to actually stand up, to say, no, I'm not going to have my people have to travel 10 to 15 miles, 20 miles. If anyone needs to travel that far, it should be the people who have more than enough. It should definitely not be the people who are under resourced, right? But the assumption is, and that's what's so infuriating about systems of power and bias, is that the hardest sort of outcomes or the most difficult challenges are being experienced by the people who have the least amount to address them. And I know you know that, but I'm wondering, as a leader, where do you find your courage to stand up to the status quo? Because in my experience, the status quo is one of the most resilient forces I've ever seen.
Uh, the courage, I have to tell you, sometimes it's on wobbly knees, and sometimes, you know, you got to get a, you got to get your cane. And, but the courage first starts with the inner work. The courage first begins with understanding, why am I here? What am I meant to do in this work? And first and foremost, that gives me the courage because that first gives me the understanding and the perspective. And then courage is about realizing that understanding with some strength and with some determination. So I try to, have a strong village, and I will call on folks to get their perspective, and getting that perspective sometimes gives me the courage that I need. I also try to be prepared and be clear with what the ask is. And I find sometimes if you're clear on that one ask, I don't have 10 ask. I'm not asking you for 20 things, but that one thing I'm going to stand firm on. Other things, hey, let's compromise. But if we're going to break bread together, that one thing, you know, we're going to have to address. And so I believe in, making it easy for people to say yes. But they don't have to say yes because, the people have said yes. I'm not putting any duty or obligation on anyone. I am just a messenger in terms of what the needs and expectations are of our patients in the community, and that's it. And I'm not taking on any other uh, obligation above and beyond that. And so, but my courage is based on my faith. It's based on just the understanding of why I'm doing this work.
That's very deep. I agree with you so wholeheartedly. And it goes back to your point about purpose. Yeah. Like once you understand your purpose, then you're either with it and aligned with that purpose and acting in accordance with it, or you're not, in which case, what are you doing?
Yep.
Like as you said, why am I here?
Mhm.
And I ask people in leadership roles to ask themselves that question all the time. I remember actually having to do that with myself where, you're making these really difficult calls and,
Mm.
there's some potential repercussions and you also are thinking about, representing your people well and so forth. But you're like, but that's my job. This is my job. I can't shrink back from my job. Why else am I here? Like, well,
That's right.
anybody could be
That's right.
here doing anything or doing nothing, quite frankly.
Yep.
But I can't be afraid to do my job or I shouldn't have taken it. And so I trust that a lot of our listeners will feel emboldened by your example and what you said here. and what you're about to share with us. So, you have quite an origin story. I'm sure a couple of listeners were like, did she just say she had a baby at 11? So,
Mm.
I have known you since you were how old?
Oh,
Oh,
since I was 19.
yes, is
Yes.
when Brenda the Almighty came into my life, my husband at the time's life, and our two best friends who we all lived together in a two-family house. And we met Brenda. And at the time, Brenda, I think you had Toya, of course,
Yeah. I
because she
was
was first,
pregnant.
and you were
I
pregnant
was
with Jonah.
Yeah, and I was in a shelter.
All right, so tell us the origin story.
Oh, the origin story. Um, Man, the origin story, I mean, it really, at the time you think about, what happened? What happened to lead, me and people, adults? What happened? What happened? Um, I mean, so much of my origin story starts with a broken family. It starts with my mom and dad, they worked in a factory in Chelsea. They had gotten married. They got, divorced when I was young. And that separation, that brokenness really carried through for so many years of my life. And it had, such an impact. And so we moved into, we were one of the first, I think we were the first Latino family, one of the first Latino families in our neighborhood. And there are so many wonderful things about living where we lived. And I met some friends. They learned how to speak Spanish. I learned English from them. They ate arroz con habichuela, and I would eat sweet potato pie, and sweet potato pone, and sakatumi cake, and all these cool, and that I thought afterwards that everybody makes this stuff, and I realized no, no, oh no, I was like some sakatumi cake, some 7 Up cake. Where'd you get that? Like, no, no. So, in the midst of all of this beautiful culture and the music and all of that, there was also, just living in deep poverty, living in deep, deep poverty. You are so ostracized and alienated from really what's happening in the rest of the world. I mean the rest of the state. I'm talking about what's happening in the downtown area. And that's how we lived. We lived like migrants. We lived very poor, very uninformed, and in some cases misinformed. But it was dangerous. Growing up was dangerous, very violent, and I was unprotected as a child. I didn't have adults and guardians, looking out for me the way I needed to be looked out for. And this young boy, not that young, took advantage of me. And so it was, and I, ended up pregnant. I ended up, carrying to term as long as I could, and not even knowing what was happening to my body, until I was nearly, some weeks from delivery. And the trauma, uh, the physical trauma, the emotional, the mental trauma that I experienced, and I carried, for many, many, many years. Um, was just I can't even, fully articulate, the devastation that it had on me, the devastation it had on my family. And so because we were not equipped to deal with this. My mom, my parents, the adults in my life were not equipped to deal with this. And so that really, I was at the time, I was kicked out of the public school system. And, so I was detached from the thing that I loved the most, which was education. That was, that I loved so much. But thank God for those adults that you do have in your life, that come, forward when no one else is there. And I had a science teacher at the time who would bring work to me at the center that I was at, because I could not attend the public school system. So while kids were entering middle school, I had been kicked out of, the school system, and getting, work handed to me to do, in a program for young girls. And so that was, the start again of a lot of disengagement and detachment. And I really struggled through high school a lot. I missed probably 2 years, almost 2 years of high school, in the 4 years that I was there. I was basically truant. But because I was over 16, there wasn't anything that they could do. And not until my guidance counselor physically came into my home and pleaded with me to try and just salvage my high school experience. But I was essentially a high school dropout. And I worked really hard and was able to get, I was a BU scholar, was able to get a 4-year scholarship to Boston University. But, ended up, I was homeless. I ended up, really running from home with my child to escape the domestic abuse and what was happening. And so living in a shelter, that itself was a different trauma. And that really impacted my mindset for so many years, having a mindset of scarcity, having a mindset just of fighting the sense of depravity. When you're in the conditions of a shelter and you're unhoused, and what you see and what you experience is so different than what normal people, and having even things like having dressers, not having a place for your clothes, not knowing where you're going to wash your clothes. Um, you know,
And also
um,
having was your daughter with you the whole time?
Yes, yes, yes. And then just trying to be stable enough to even pick a school. And I remember, early mornings, 5:30 in the morning, leaving my shelter to go to the corner to get on the bus to drop her off, to for her bus to pick her up, to take her, to Lexington, Massachusetts, because I wanted her. If I didn't know anything else, I knew I wanted her to have a good school experience. But the trauma after trauma, from what happens once you encounter something that's devastating in your life, and it puts you further behind, and then those incidents then result in more incidents because now you're in spaces where are not healthy, or not functioning, and so that continued on, for some time, and even when my choices, were not optimal. They weren't bad choices, but you'd almost have to live a perfect life and not make any mistakes ever to try and
Exactly.
just catch up. But I was fortunate, meeting you and discovering a church community, which was a learning community for me before it was even a spiritual community.
Yes.
And that really helped me to gain perspective, and it helped me to just stay just above water, above water enough to just have a little bit of sanity, a little bit of motivation, and some self-worth to do the inner work that was needed. And that really started at that time, to do that work.
I still remember when we first met you, and I well, first of all, I still can't believe what you were able to accomplish in the situation that you were in, because you were at BU, but you were in the shelter. You had Toya, and we were like, How is she doing it? What?" And so, we were new and we weren't perfectly resourced, but we did have a car, right? We had
Yes.
2 cars between the 2 families, and we were just like, "Why don't we meet her at the bus stop, scoop up the kid afterwards? She can study here," But you know what it made me think about, and what you said so much about choice, it's like, I'm amazed at how people insist that folks who have the least be the most perfect, when
Yes.
people who have a lot can't even pull off perfect. But so much of your success was this incredible mindset. And I don't know how you got it. It was just you were moving forward, you were studious, you were bright, you were gonna make it happen. And because you were gonna make it happen, we were gonna do whatever we could to help you make it happen. But by far, I mean, you always serve to be such a role model for me, to just see what is possible in community. In
Right.
community, it was very clear to me that the reason why not more of us can make it through is because we don't have community. Like individuals can't do these things all by themselves, right? And even people who think that they're doing all their individual stuff, they're being supported by some community, whether they want to acknowledge it or not.
I think that's another reason I find myself at a community health center because we have to be together in this work. And even if you sometimes think you have the same lived experiences, there's something about coming together that brings a newness and a freshness, especially when we're all trying to do better for ourselves, for our families, for each other. And even something I remember one of the first Kwanzaa celebrations that I experienced with you in your home. And I remember just a sense of pride. I remember feeling a sense of I'm a part of something. And at the end of the day, I just want to be a part of something. I want to be a part of something special. And I want to give that feeling to every single staff person, every single person that I come across their path. I want to just be able to and I just bring that out of myself and just, impart that on others. Just be part of something special. And if I can do that in this organization, if I can do that in my personal life, in my professional life, with my family, with my colleagues, I feel like I would have, just cracked that code just a little bit when it comes to health, because that is health. Community is health. Having conversations, having support, having someone to listen to you, having the wherewithal and just the mental capacity to even think about your health, to even think about what you're eating, to take that walk, to really even comprehend, what are some of the things I should be doing, to not forget appointments, to remember I need that mammogram, to remember, oh, I'm due for that screening. All of that takes capacity. And you have to be in community because we got to be taking care of each other. And so I know we can do that. I know we can have a healthier neighborhood. I know that people can live their best lives, and I know people can understand what does it take individually, personally, to feel great in every respect of the word. And
Wow.
I know we can do it. I know that we could do it, and I'm one of those leaders in the space that is committed to that.
I love that you said community is health because it's kind of the one thing that I really noticed that in our individualistic world, right, we somehow don't recognize that we all need community. We all need to be together. We have big problems that are not going to be solved by an individual, right? And it's great. Individuals have their contributions, but ultimately we do need to find community and the beloved community at that. And when we met each other, we were in community, we were
Yeah.
in a church, and
Yeah.
so I wanna know more about how faith has really supported your journey and how it's shaped what you do and how you think about what you do.
So I will first start by saying my faith has saved my life. I believe literally, figuratively. And I mean, the role that faith has had um, in my life has evolved. At first, it was I need a shoulder to cry on. I just need a shoulder to cry on, and I still need a shoulder to cry on. I still need a shoulder to cry on. But what faith has been more and more in my life has been that that secret weapon that I have that gives me ideas, gives me perspective, and gives me a new way of thinking about something. And so when I think about why am I thinking about it that way? Why is my mindset the way it is? Why did I, have that courage? What is that? And it's because of my faith. It's because I am. And why am I even willing and have that feel that overflow that I can even work on myself. And it's definitely faith, and it's indomitable. It's something that is so a part of me that it influences everything I do. It just is as I go about my day. There's very little that keeps me down for too long because I just know what I've been through. And I know sort of, that there is this journey and this path that is God given and God ordained to do something that's very powerful. And so, it is my secret weapon. And so I am just ultimately blessed.
Tell us about your family. and
Oh, no.
how and what role they play
Let them
in
not be
your I know, you're smiling, smiling, smiling.
huge.
Yes, tell me about the kids.
Oh my gosh. So my, my lifeblood, just my, we have different purposes and they're a different purpose in my life, my legacy. So I always say, Toy is my inspiration, Jonah's my determination, and Paige is my aspiration. Sometimes they'll say, wait a minute. Why am I not your determinant? Wait, why am I not your, you're trying. And so, but that's because they reflect where I was in different parts of my life. And so, but they are all, what I want to be, what I wanted to be in my past, what I want to be in my present, and where I'm going and who I want to be in my future. Um, they represent kindness, generosity. They just are forgiving. They're forgiving, and they have abundance, in just in how they share and how they live. And they serve, their communities in different ways, and I admire that so much. When I think back in terms of, I had a little, this tight little script in terms of what I wanted each of them to do. It's like, no, you go through school, you do this and you do this, like every other parent, So it doesn't matter if you're an older parent or younger parent. We all want our kids to do what we want our kids to do. And so you got to read certain number of hours per day. You got to do this and don't do that. And but they mean so much to me, and so and now, with grandkids, coming along as well, but, I get a chance to, be in communion with family members that are like-minded, that are also seeking to be their best selves, that, want to give, to to each other and just want to be great contributors. And so I admire them for that so much. I admire them, and it just fuels me to continue to be a good role model and be vulnerable and to be humble and to be just in a space of learning and also to have fun. So now as an adult, I remember for a long time, I would have moments of laughter, moments of joy, but I don't recall ever feeling happy growing up. Now I just have like this joy. I just have this overflowing joy. And to share that with family, to share that with loved ones that get it, that understand it, um, it just gives me the confidence and the validation that I'm making the right decisions.
I know that you made some good decisions because those kids are a reflection of you and of your values and of what we learned in church and all of the way that we felt responsible for others within the community and finding our particular calling or role in making the world better. And they are blessed, and so many others are blessed that for probably a host of many reasons, you have evolved into this person who is joyful, full of joy and sharing that joy with others. And that is a blessing. And you make sure that you talk about being an inclusive leader. And I feel like part of that part of feeling included is that sense, right? That feelings that you were mentioning, like people see you and they
Mhm.
acknowledge you and they value you. But, we do try to talk about that on this program so that
Yep.
people who are listening can think about what they want to do or how they might want to be more inclusive. So, what do you bring or what do you think inclusive leaders or people who want to be inclusive leaders, what should they be doing? What should they be thinking about? What
Yes.
should they not be doing?
So, I mean, it first starts with thinking about, in a space of inclusion, how do you want to define yourself in that space? And so for me, I decided I'm going to be intentional about being inclusive, and I made that one of my year one goals that I shared with the board, and I shared that out with the entire workforce. And so for me, right now, today, what it means to be an inclusive leader and the actions that I am taking to be inclusive. start with first and foremost, who do I share information with? What is the information that people across the organization are getting? And so, if that information is so important that I am sharing with our board, our senior leadership team, and others, I'm asking others to share with their staff. If I'm asking others to share something that important with their staff, that means I value it. So I made a commitment to the organization that if there is something that is so important that I need them to know, I will share that out to them directly and personally in my voice. And I have been doing that, and I've made that a commitment. So although we have a wonderful marketing and comms department, and they do, write a lot of things, if I need to get a message out with my voice, I will do that. And so what information is being shared, I committed to them that, there is some information that they're going to be hearing and they're going to be a part of. So whether it's bringing your voice in terms of an engagement survey, so we can understand their experience, and they hadn't been asked in many years about what do they think, what do they think about the management practices, what do they think about leadership, what do they think about their CEO, and so making sure that they have an opportunity that's anonymous, that's confidential. And sure enough, I gave them that opportunity to do that. And then making sure that our board and those that are holding a system accountable also have that information. And so that is a priority for me. They hadn't seen some data. And so, what is the data that we're making available to them? And who is talking about that data? And how nuanced and aggregated and disaggregated is that data? And are we being honest and truthful about the limitations of that data and what we're going to do with it? So I made a commitment to them about that. And then to me, inclusion and equity really has to do with also who is sharing with the benefits. And so I made a commitment that if we have an operating surplus, that everyone in the company is going to benefit from that. So we were able to give, back to employees a significant amount of our operating surplus, which for, a local nonprofit, typically it's usually an operating, you don't have much of an operating margin, if at all. But people need to know that their work is making a difference, especially when we're in a space where there's already pay disparity compared to, when they're compared to their counterparts down the street at a hospital system. And so, so that's important. So making sure that, we're looking at things in an equitable manner, but communicating to people what that is. And also making sure that there's training and development. So another thing that I committed to is people like myself and our providers, our doctors, and those, that are getting CMEs, we can go to any conference. And so you have the most educated and the people with the most opportunity and access getting the best training, where the 90% of other staff are getting very little training. Everything's on the job training. So I have, I am turning that around. So that way that people that are in most need of training and education, that we're not just doing on the job training. And so I made that commitment to them as well. So thinking about as a leader, how are we defining and being intentional about inclusive practices? And they have to be looking at policies, looking at management practices, looking at yourself. Who are you speaking to? How are you communicating? And who, when we talk about inviting people to the table, what's on that table? What is that table? And making sure that that's being defined. And the other pieces, is making sure that, when we look out as far as who is getting those opportunities, who's getting those promotions, and who is getting, sort of that part of that inner conversation, bringing more and more of those individuals to the table. And so whether it's skip meetings that I have, whether it's, having, I call them, kind of open meetings, whatever it is, to making sure that people can bring their voice in and also feel heard. So make sure that that I'm communicating and making sure that I'm hearing from the right voices. And so to me, there's many things that we can do, but those are some of the things that I'm doing to be an inclusive leader.
Yeah. And, when I'm listening to you, I'm hearing all of the, studies that suggest what really enhances engagement and brings joy to the workplace. And it's everything you talked about. It's not just about having opportunities and compensation, although that is really important. It's about the transparency and the information and the communication and the development. People
Yes,
want to develop. They
they do.
want to have an opportunity to grow. They
Yes.
don't want to stay, forever doing the same thing or only knowing certain things. And so I think you are absolutely on the right track with that. I am really thinking a lot about the young people that
Mhm.
we hear from and we
Yeah.
encounter, many of them who either cannot find a position or the position that they found is not exciting and, encouraging to them, or they're not valued. And it just feels like they're encountering so many obstacles, all the isms, all the bias, all the
Mhm.
disrespect, and
Mhm.
also people just not asking for their voice or input.
Yeah.
So how do you encourage, I mean, what do you say to younger folks about overcoming obstacles? Because you have overcome quite a bit.
One is that they're gonna encounter many obstacles. And so some of this is recognizing that because when obstacles come as a surprise, it pushes you further and further down. It just you feel so discouraged. We think about sort of our journeys. When I think about my journey has been the desert. It hasn't been, beautiful, in a beautiful island with palm trees. It's like walking through a desert, going up a mountain with thorns everywhere and just being scraped up and falling down the mountain and getting back up. Understanding your journey is so important, and some people, our journeys are just that a bit more difficult, a little bit more difficult. So, I say to young people, learn when to be humble and learn when to be bold. Be bold with asking for mentors. Be bold about asking for assignments, creative assignments, and always offer recommendations, always offer solutions. I find it so refreshing when I hear a young person mention to me, they see this opportunity, this it hasn't been working, and they bring to me some recommendations, and I'm like, I'm blown away. I'm blown away. I'm like, can we all please, people, see this example? Can we all just pick that up? Pick that up and let's go run with that. So part of it is that inner work that needs to be done in those practices, and understanding, doing those practices very early in your career. And the other thing is, um, how we start, and which can be so frustrating because oftentimes, I mean, look at the work that you're doing, the work that I'm doing. It took me decades to begin to do the work that I feel fulfilled in doing. And understanding the horizon. And the horizon might not be a few months or a few years. It might be a few decades. It doesn't mean that they have to suffer along, but it does mean that where do you put your focus? Put your focus on developing those skills. Put your focus on really gaining that experience, even if it's not the experience you expected to get. What is that experience? And if you have an opportunity, joining boards, doing community service, and whether it's in a church, whether that is at a local social service organization, but putting your talents in don't have to take a step back. Just you have to just find a more creative way to apply them. And I was practicing my skills and my talents way before I was able to express them in a formal job role, whether it was serving on a board, whether it's in my church, wherever that was. And so you got to be creative in terms of how do you get that skill and how do you let this talent, the genius, let that out. And sometimes, and few times, is it going to be in the structure role description that pays you your paycheck.
Yeah, I mean, you started off your career in a very large accounting firm. And I know a lot, having done the work that I have in these kinds of service firms, professional service firms. And yeah, it doesn't necessarily seem like the best place, but sometimes you have to, like you said,
Yeah.
like use the opportunity to hone some skills. So will you tell us a little bit about that? Especially if, you're dreading going to work, you can't stand that person down the hall, your boss is this, whatever. How do we get people to think about how to make that a useful experience, if not a pleasurable one?
Yeah, yeah. I mean, part of it is, have your roadmap. Think about what some of the things that those skills that you want to develop for that future role. Not everybody wants to be a CEO. Not everyone wants to be a leader. People want, want different things. But if you need to learn project management, some things you learn at work, some things, you take a little webinar on your own on the weekend. Some things, you just ask a friend, hey, can you show me? But learning, whether it's your technical skills, and I always say, whatever job you're in, absolutely learn all the skills to do that job the best that that job can be done within your capacity. But having opportunities to write and to practice advocating for yourself and others in every single job you're advocating. Some places we call it negotiation, some other places we call it sales, but it's all advocacy. And so, that is something that whether you're a CEO, whether you're just coming in as an associate, um, learning about those things that you have to stand up for and practicing that. It may come in handy when you're negotiating your salary. It may come in handy when you're applying for the next job and you're trying to express your value proposition. It may come in handy when you are standing with hundreds or thousands of people in terms of, advocating for something that is personally important to you. So those are the kind of things that really help us develop as people. And focusing on that, I tell you, even if we don't find that job, those people in that job will find us. And so it's part of faith, it's part of trust, and it's part of preparation.
I love that. So I'm gonna let you go, but I did want to say or just ask you, like, what and who is inspiring you these days, and what are you excited about?
Uh, what's this? What inspires me so much is right now, our patients inspire me because even if I try to run away, I can't. They connect me back to my past in a way that fuels me for what we can do for the future in terms of making health and wellness a reality for so many. Um, and so they inspire me. And what I'm so excited about, I am so excited to be building leaders and building organizations and doing it in a cool and fresh way and helping people sort of, whether someone's been working, in a role, and they're almost near retirement or they're just starting in, just helping them see that there's newness and there is something powerful that we can do if we just, trust each other a little bit and if we just really summon our best selves. And that's what I ask the people. Just bring your best self. Bring your best self, please. So that excites me. Just setting those expectations, living up to those expectations, even if I'm failing them every day, but just looking forward to living up to those expectations. It just invigorates me.
I forgot we've got a new question we're asking all our guests now, and you talked about newness. And so I just wonder what, if anything, you've changed your mind about recently. This is
Mm.
an exercise I'm working on with myself because I want to stay curious and I want to stay, malleable and be in a growth mindset. So,
Oh, man.
yeah, you changed your
That one
mind. It can be small, big,
There's the whole
whatever.
okay, so I actually, there is something I recently changed my mind on. Although, when I first just heard you ask it, I'm like, I tend to be very decisive and I usually have a clear point of view and I don't change my mind that often, okay? Because you know what? I'm like, you the past. I'm kidding, please. We're
I
not
love it.
reversing course here. We're not reversing course here. But there is something that I recently, I changed my perspective, and that really is around how I am now in relationship with my parents. And so up until recently, I just, felt like, I'm just nagging them about so many different things. It's like, well, if you just write that down there, of course you're going to miss your appointments. Well, you said you were going to call so and so, look, you didn't do it. And sort of being, having like this like constantly expressing either disappointment or overcorrecting, on things. And so, and part of it is because they need the support in different ways. And, recently, I realized that, I don't know what it feels like to be 25 plus years older than I am right now. I already know I have my own, frailties, my own things that I'm dealing with. And so the whole notion of grace. And so I like to think that I'm extending grace, to my kids, my colleagues. And I was thinking recently, where is the grace for my parents, for my mom, for my dad? Where is the grace? And so I want to, this thing about honoring your parents. I sort of like I thought that that was something like back when I was a teenager, and now it has a lot more meaning for me. And I'm thinking, I have to think about what does it mean to honor my parents? What does it mean to extend grace? And I tell you, that is when I say that is flipping a page. That is like that's getting a different book. I don't even know that's flipping the page, okay? And so that is one thing that to be a better human being, I really that is the next thing I need to tackle, and I need to
Ah,
tackle.
I love that. And I'm sure a number of people are in the background going, Amen, because so many of us are in relationship with our older parents now. And we have the opportunity to show the grace that we often were shown by our parents, right? But it's sort of the issue of power, right? You start to have power and resources, and it's work not to use it incorrectly. And I'm just so grateful that you reminded of us of grace, and certainly we all need it to make the world go round. So, Brenda Rodriguez, thank you so much for spending time with
Um,
us here on Sundays with Renee. We are so grateful for all of the brilliance that you shared.
Thank you so much. It was an honor.
Thanks for joining us. Be sure to follow me at Verna Myers on Instagram and Twitter. You can also listen to my podcast on Spotify and Apple Music. Subscribe to my channel and share this episode with someone who is going to join us in this space. Make sure to visit my website for DEI resources and online learning courses at vernaymyers.com. And make sure you sign up for my newsletter to stay in touch with me. Thank you again for listening, and see you next time for more Sundays with Verna.